My name is Dr. Leilani Garcia. I'm an internal medicine physician at Samaritan Medical Center. I started college at Jefferson Community College in Watertown, New York, where I completed 2 years of a science degree and transferred to SUNY Albany in Albany, New York to complete my Bachelor's of Science. From there, I went on to study further at the American University of Antigua College of Medicine in the West Indies and did most of my rotations up and down the East Coast. I later completed a residency in internal medicine at Harrisburg, PA at Pinnacle Health Systems, currently UPMC Harrisburg. So I'm originally from San Antonio, Texas, which is a huge military community. My father was active duty military, and most of my immediate and extended family are also active duty military. So when I decided to come back to the North Country, it was a no-brainer for me to be a part of a military community, which is something that I really wanted to practice in for multiple reasons, but mostly because I grew up in a military household. I actually later married my husband, who was military as well. So to be able to help serve a military community and such a hardworking community such as Watertown in the North Country is very fulfilling. So I came to Samaritan for several reasons, some personal and some professional, but really I wanted to challenge myself in coming somewhere where I could take care of those patients who are considered sicker in our community. I really thought it was great that there was an open ICU with hospitalists who could care for those in the ICU and in collaboration with specialists, and also having the networking that Samaritan has with the bigger facilities. I thought that was great, and I wanted to step back into that kind of medicine again. My favorite part of caring for patients is being able to treat them at their sickest, but knowing that eventually they're going to get better. And so seeing that process of them healing, to me, is my favorite part, because getting them home to their families is ultimately our goal. I chose medicine mostly for personal reasons. A lot of my family is in medicine, but I'm the first doctor in the family. My grandmother was from Mexico. She came over with polio, and the only way she would have survived is if she would have come to the United States for treatment. So she was adopted and received treatments and survived polio because of modern day medicine. So when I learned this story was when I decided medicine was what I wanted to do, because I wanted to also be able to help treat and save lives. I went into hospital medicine based off of multiple reasons, but one case in particular kind of stands out to me. In training, we were very heavily trained in critical care and ICU training. We were at a large facility in Harrisburg. So the first time I was sent down to the emergency room to admit a patient on my own, I was a second year. And I remember being on the fence about what I wanted to do exactly after my internal medicine residency. Should I go into hospital medicine? Should I go on for fellowship? And I was sent down to do an ICU admission by myself, and this man was very critically ill. He had a heart attack. He also had a stroke, and I was the person needing to determine what we should do first, what was needed, and it was all hospital medicine in that moment to save his life. And later, even now, I think back to that as being probably the case that helped me determine that I wanted to stay with internal medicine, hospital medicine as a hospitalist, because I enjoyed the challenge of it and being able to tackle multiple things at one time within the hospital and having all of these things available to you in that moment.